Yes, I think. Oh, okay. Yeah, okay. Yes, getting. Okay. Yes, welcome. It has been a very long weekend. We are back to work. We are back to work. Back to us, euphorious. Back to work, euphors. The vacation has been nice, and as you saw, in Africa, people celebrate these things. And, it's good to relax. So last time we talked about congenital heart diseases, and we discussed and characterized them, and we classified them. I can remember we classified congenital heart diseases into two: cyanotic and acyanotic. Acyanotic, I said, is when a person or a baby has the condition, but the blood that is coming to the heart has oxygen. That is called acyanotic. The blood that is coming to the heart has oxygen. And we classified again a blood under cyanotic. Cyanotic means that the blood that is coming into the heart and going to the system of the body has less oxygen. So we characterize them into two: cyanotic and acyanotic. And then under cyanotic, that has oxygen. We said, boss one, welcome, welcome. Thanks a lot to sign in. Thanks a lot to sign in. I'm just giving a recap of what we did last time. We said that babies that are born of cyanotic heart disease, yeah, we have one atrioseptal, a hole between the atriums connecting them. I think look at that. Good when we talk about and look at the heart itself. A hole between the atrium, right and the left atrium, ventricular septal. We talked about ventricular septal. We talked about patent atrias, patent ductus arteriosus, a hole between pulmonary vein and the pulmonary artery and aorta. And then we talked about coarctation of aorta, constriction of this aorta. Those ones. Kingray is here. Judy, hey, hi. Hope your vacation has been so nice. I'm just giving a recap of what we were doing last time. We categorized the ones, cyanotic ones. We said that cyanotic ones, it is blood is coming to the heart, the left ventricle, but it has oxygen, a bit some oxygen. But this one we gave atrioseptal, a hole between the atrium, ventricular septal, a hole between the ventricles, and then we said ductus patent arteriosus, a hole between the pulmonary artery and the aorta. And then we gave another one, coarctation of the aorta. Those are the four that we discussed, about a cyanotic. You have the problem, but at least you have oxygen in the blood. Uh, Atrioseptal, ventricular septal, patent ductus arteriosus, and coarctation of the aorta. And then we saw another one, which is cyanotic. Cyanotic, we said, it is one condition that is called tetralogy of Fallot. Tetralogy of Fallot. Tetralogy of Fallot has four Tetra means four. So we say tetralogy of Fallot, someone does not have oxygen. One, we have characteristic of tetralogy of Fallot. We said this one is tetralogy of Fallot is a complication whereby someone has a heart, but has a heart that has four at the same time. One, we have right ventricle hypertrophy. You remember, it's combination of four. Right? Wait a minute. Just a minute. We continue, we said this one is a condition that the heart has four types of problems. Ventricular septal defect, one. And you remember in the other one, which was a cyanotic, we had that one, ventricular septal defect. A hole between the septum. That is one complication in tetralogy of Fallot. Pulmonary stenosis. These arteries, the pulmonary artery is constricted. The pulmonary artery is constricted. And then we have overriding aorta. The aorta is positioned directly over the ventricoseptal instead of arising from the left ventricle. You see what is overriding aorta? Yes, I mean, the overriding aorta means the aorta is directly, the aorta is positions directly over the ventral VSD, ventricular septum, here, instead of arising from the left ventricle, allowing mixture of oxygen. So it is this aorta comes and it starts from here, where there is a hole, allowing mixture of oxygen. You get it? Instead of coming from the light atria. Right ventricular hypertrophy. Because of all this, there is the right ventricular hypertrophy. And then we saw another condition called the TAPAV, TPA. This one is another one that people have a problem. It is called total anomalous pulmonary venous return. This one is another condition. It comes with pulmonary veins drain into the right atrium. This pulmonary vein comes and drains into this atrium. You get it? Or vena cava, inferior vena cava, or you see, total pulmonary anomalous, TAPAV. Those are the two main complications that you can have, and then you have a problem with oxygen, but it's still a problem. One we have said is tetralogy of Fallot, and the other one is TAPAV. So tetralogy of Fallot has four main complications. A hole between the septum. Two, we have pulmonary stenosis. This artery is small, constricted, and then we have this right ventricle is big, and then we have the aorta overriding the pulmonary vein, and then it is coming here where the hole of the septum is, here where there is a hole. So it allows the mixture of deoxygenated and oxygenated blood. Those are four complications when it comes to tetralogy of Fallot. But we have another one, total anomalous, total TAPAV. It is called total anomalous pulmonary venous return, whereby this the pulmonary vein comes and hooks anywhere, here or here at the right atrium, instead of having its way normally. Now, those are the conditions that we discussed last time, and they are called congenital heart defects, CHDs. Congenital heart defects are defects of the heart that babies are born with. Those are defects of the heart that babies are born with. There are some things that make some people to give birth to this, and that's why we want to fast. Jamaican uncle, greeting to you, Dr. Benjamin. Welcome, uncle. Thanks a lot for signing in. We are back at work, and as you can see, I'm here doing 1, 2, 3. Please, like the live stream. Yes, thanks, boss one. So let's check it out. What can we do? Because these are conditions that people are born with. It means when you are a fetus in the mother's womb, it means it is a problem that starts when a fetus is in the mother's womb. So how can we help this fetus so that it cannot come out, this baby, so that this baby cannot come out with such complications? First, we will see how to prevent, and then we manage. We manage when it is there. When it is there. Now, greetings, Miriam Mumbwa. Greetings, J_Kingre, and Jamaican uncle in the house. All of you, you're my fans and my friends. Now, I usually say you post your links of those who have channels, because some people call me and say we are seeing links, and when we follow the links, we get some good content. We get some good content. If you have good content, someone will follow and will like you, and you will get more and more. There is someone who told me, I followed the link that was in your chat, and I saw a very good content on gardening, and it was so encouraging. I told him, yes, all those people that are asking questions in the chat and following me, they are my fans. So most of them have channels, and if you follow them, you can get some good content. So we are team positivity. Let's continue like that. And if anyone is here who can continue posting the links, please continue posting the links. Many people are watching these talks after we have talked, and they follow the links, and you get some subscribers. And if you are doing your work, you get some people that will support you. It is like advertising yourself. Yes. Now, we continue on management of congenital heart diseases. I've said congenital heart diseases are diseases that people or babies are born with. Babies are born with. So, how can we prevent a baby or a mother from creating this complication to his or to her baby? How can we prevent? It is very important to prevent some things before they start. When you are immediately, now I'm talking to mothers and fathers who wants to get babies. Yes. Now I'm talking to you who has grandchildren that have come to the age of giving us babies. I'm talking to you who have them in their house, and I'm talking to you as a parent who is, let me take a sip of this a bit so that I can come clear. You see, many people have these defects because of lifestyle. Nice. Very nice. Yes, we chap and go. You, when you come and know that I'm pregnant. You see, I am pregnant. The most important thing when you should start is start clinics. People say you wait for some time. You should start immediately. And let me tell you why you should start immediately. Because at the time, I'm talking like Hallelujah now. I'm talking with an accent. At the time of conception is where you start having what? You start having the formation of your baby. And this is where the layers of embryology starts to form. So it is very important this time you start clinics and you start follow-ups. You check me out. So the first thing when you go to the clinics, what are you given? You are given folic acid and iron supplements. Iron supplements because we want your baby to grow without being healthy, without malnourishment. But there is something else which is so important. As a mother, as a father who is telling your granddaughter that go to the clinic and get, as a parent who is telling your granddaughter go to the clinic and get supplement. What do you think the supplements do? One of the supplements is folic acid supplement. A folic acid supplement is a very important supplement when you are when you have conceived and embryology, the formation of the baby has started. What does it do? Folic acid is used in synthesis form of vitamin B9. In a form, you see, vitamin B9 is folic acid, essential for DNA synthesis, cell division, and formation of red blood cells. So just a little, I was about to talk in Swahili, but I realized here we don't talk in Swahili. We are worldwide. Now, at the point of cell division, that is the critical part where the folic acid comes in. Folic acid helps in cell division when the chromosomes are dividing. The process of mitosis and meiosis, those that did biology in high school, you remember? Telophase, anaphase, metaphase, telophase 1, 2. Now, you can have a baby, don't take folic acid, and then that process goes very slowly. You see, DNA synthesis is when now you and your persons, the eggs are fused. Now they are starting to form, and the DNAs are now forming your body parts. So if you don't take the folic acid, what you will have a problem. This is where congenital problems start. Maybe the formation of a limb will be slow. Maybe the formation of your heart will come up with septum problems, the whole problem. Why is folic acid very important in pregnancy? During early pregnancy, the baby brain and spinal cord development from neural tube now. Let me show you something very fine. Okwemba, how is you my namesake Okwemba? Okwemba is here, my namesake. Welcome to the talk. If you are, I said one day I'll meet you very soon. Very soon we will meet. Now, these things come like this. The sperm has fused, and then it comes like this. The fusion goes in, and then it comes out, and then it forms a tube. So through that tube is where things starts to flow out. Now, that is what we call the neural tube. Folic acid helps in process occurs normally, because you are giving it. It's like giving manure to a tree that is small, that is growing. It will grow up very healthy. Yes, it prevents birth defects, like adequate folic acid prevents neural tube defects. Yes, spinal bifida and anencephaly. So, women, when you have problems the first months of conception, or when you just realize I've conceived, start going to the clinic, do a full hemogram, check HBs and venereal diseases. Very important. I am Naliaho is here. Welcome to the platform. I am Naliaho. Is this your first time? We are talking about managing congenital heart diseases. That's why you are seeing there is a picture of a heart here. There is another picture of a heart behind me. Yes, I'm Naliaho. Welcome to the platform. Do you have hello, Benjamin, the wise guy. Do you have a platform? If you have a platform, talk to Boss One. Let Boss One share your link. Now, let's continue, my fellow people, my fellow guys, my good guys here. We have talked about the folic acid. Second one is chronic diseases. Now, what are chronic diseases? Chronic diseases are diseases like hypertension, and then diabetes, and then we have cerebral diseases like seizures, status epilepticus. These are diseases that when you have conceived your baby and you have them, like diabetes, the taking of diabetes, welcome all, welcome to the platform. If you are not here last time, you know the weekend has been so long. The last time we were, let me give a recap. Let me give a recap. The last weekend we were discussing about congenital heart diseases, CH, problems of the heart that babies are born with. And we categorize them into two, cyanotic and acyanotic. Acyanotic, we said, is the diseases, the complication, but blood is coming with oxygen. But cyanotic is the complication, but the blood is not coming with oxygen through the body. So the cyanotic ones, the acyanotic, let's start with the acyanotic, the one that has problems with has problems but with oxygen. We said, let me turn to my heart. One is atrioseptal disease, a hole between the atrium. Two is ventroseptal, a hole between the ventricular system of the heart. Three is pulmonary stenosis. This pulmonary vein becomes small. Hey, Miss Marie. Hey, welcome. Pulmonary. And then we said another one, which is coarctation of the aorta. The aorta becoming smaller. So, they are here. Atrioseptal, ventricular septal, patent ductus arteriosus, a hole between the pulmonary vein, and the last one is coarctation of the aorta becoming small. So cyanotic, those ones with problems, problems with oxygen, we say it's called TPAV, total pulmonary and anomalous vein, where this pulmonary artery, instead of coming where it is here, it is coming here, getting blood here, or it is coming and dipping itself here, where the hole is. The septum is here. So it is always carrying deoxygenated blood. Those are, and then we talked about something called tetralogy of Fallot, and we said tetralogy of Fallot has 4 problems. The right ventricle is swollen. There is a hole in the septum. You see, and then there is tetralogy of Fallot. There is constriction of the pulmonary stenosis. This part pulmonary is smaller, and then we say right ventricular hypertrophy. You see, that is tetralogy of Fallot. So as we continue to learn. We have said women, we know some people, they are at the age of giving birth and they are at the age of, first point we have said, women, please go to the hospital and get folic acid. Go to the hospital and get folic acid. It is important, and we have seen why it is important. It helps in DNA synthesis at early stages of conception. So those people that are checking me out here and you are at that, please check me out. But please remember, if you are doing that and you want kids, immediately you remember that you are pregnant. Immediately you remember that you are pregnant. Run, go to the hospital. Do something that is called full hemogram. Do something that is called venereal diseases. and check if you are hypertensive or check if you are diabetic. And that is our next point. Yes, that is our next point. Or is there anyone who is pregnant today? Yes, if you are pregnant, raise your hand. We give you some tips of avoiding your child in the womb to have what? If you are coming in right now, please share the platform and also like. Now, when we are going to the next point, control of chronic diseases. Control of chronic diseases. How do we control chronic diseases? If you are diabetic, make sure you are visiting your clinics and your sugars are okay by use of a good drug or a good therapy that is needed. Like what? Some people are given drugs, some people are given drugs, some people are given insulin according to the type of diabetes that you have. If it's type 1, you always know you use insulin. If it is type 2, you are in drugs. Or you see, if you are having convulsive disorders like epilepsy and you are carrying a fetus, please go to the doctor. Let the doctor define why you are convulsing, be given a good therapy so that you cannot, convulsions can make your baby in the stomach. The differentiation of embryology, that is the growth of the fetus from an early age, it can make you to have a problem. So, my friends, that is it. If you are, you have that problem, please check out and be helped. Now, we have avoiding alcohol closes the placenta and can disrupt development of the heart. So anyone here who is a drinker, and you are a lady, and you know you have you will give life one day, or you have a boyfriend or your husband tells you one for the road is good, one for the road is nice. Now listen, alcohol closes the placenta. Alcohol crosses the placenta and can disrupt heart development, leading to fetal alcohol spectrum disorders to your baby. Check out those people that are drinking, those ladies that are drinking. Most of their babies, mostly, they are born when they have some problems, either malnourished or some defects. You get? Because alcohol closes the placenta. It is alcohol, carbs, carbohydrates, hydrocarbons. So it has to cross the placenta. And you're there saying, I'm pregnant, but one for the road is okay. Look at me. Look at me, my sister. Your husband is telling you one for the road, it cleans the way. You stop smoking and drugs. Nicotine and toxins reduce oxygen supply to the baby. Nicotine and toxins, as we listen to this talk, if you have a question, it's an open platform. Please post your question. If you have a question, don't forget to post your question so that we discuss. These are ventroseptal diseases that are cyanotic. You see now how they come. So if you have any medical question or question according to what you are doing, remember to post that question here. We have said nicotine and toxins. Well, hello, Okwemba, how are you doing? Okwemba, tell Marie how you are doing. Tell her you feel fine or you are down, you want to do a collab with Miss Marie from Nairobi. That will be very good. As seeing you doing a good collab. Good. Now, nicotine and toxins reduce blood supply to the fetus, poor heart formation, and growth restriction. You give birth to babies that are malnourished because of smoking. And I've said always, anyone who is smoking, please, if you are smoking, raise your hand. If you are smoking, raise your hand. We see you. We help you. Every topic that we have come across on management, you realize every topic that we come across on management has stop smoking. Stop smoking. Stop every management. Stop smoking, and you are still smoking. My friend, stop smoking. You can see even medically, smoking is. I don't know why smoking was legalized. Because if every medical talk we have, we talk about stop smoking, and many governments have legalized it, they only illegalize the herb. Where is the connection? Where is the connection? Because the herb makes you psychotic. Uh, they should legalize even the stick, the smoking itself. Now, review medication. Some drugs are teratogenic. There are some, when I'm saying teratogenic, I mean some drugs can destroy when you are pregnant, some drugs can destroy the fetus, when at an early age, interfere with fetal development during the first trimester and when the heart is forming. So it's important we know the first drug that I know is teratogenic, maybe metronidazole. Let's see teratogenic drugs. Which are the drugs that you can take when you are pregnant and you become? Let's see these drugs. Which drugs do you use, or how many people are between that age of we say the age of fertility, the age that you can give birth. If you are here and you are between this age, now listen to us. Miss Marie, I gonna subscribe to you. Of course, Okwemba, what are you waiting for? Subscribe to that beautiful lady from Nairobi. You never know, one day you can do a collabo and it goes very viral. And then we feel nice that you met at Benjamin the Wise Guy Medical Talk. Miss Marie, smile back again and say, after 24 hours, eh? Smile back and say after 24 hours. Now, teratogenic drugs are drugs that can cause structural defects to the baby. They can, drugs like warfarin, if you are under drugs that give you have clotting disorders and you're given warfarin, you should go to the doctor and the doctor to review. You see, phenytoin, those people that have problems with epilepsy or convulsive disorder. Yeah, thank you, Okwemba. I'll be turning back to you. Make sure you leave a comment. Of course, I like connection. Yes, let me not say the other connection. Listening and watching me and you have not subscribed, you are missing a lot. Please subscribe. Now we have phenytoin. Phenytoin is a drug that is used to convulsive disorders like epilepsy. So when you are using it and you have conception, visit the doctor, tell the doctor I'm using this drug. Is it harmful to the baby? You see, these are drugs that can give you these congenital heart defects, cyanotic and acyanotic. You get it? Methotrexate. Hey, methotrexate is a bad drug. When you are pregnant, it is a bad drug. It causes your baby to be born earlier than expected, earlier than even the dates of being born. It causes abortion. Who needs abortion, by the way? We don't like those things. Severe congenital malformations. Severe methotrexate. If you are a person who has been having arthritis and you are at a level that you have been given methotrexate and you are a lady and you know I've been using methotrexate and you want to have that baby and give birth to a bouncing baby, boy or girl, go to the doctor, tell the doctor that I am using methotrexate. Please change me to this drug, because if you don't, you will not see that bouncing baby boy. ACE inhibitors, angiotensin converting enzyme inhibitors, like these are antihypertensive, losartan. You see, can make kidney failure in fetus, low amniotic fluid. You go to the hospital and then you're told your fluid is low. You see now, those people that like using Tetracycline as an antibiotic. Your childs are born with teeth that are brown and very weak. The problems with poor bone growth. You are born with bones that are very weak. There is a condition called osteogenic imperfect. Eh? It is because of tetracycline. You are of course using tetracycline anyhow. Those are the drugs that can damage. And you know, we cannot live without saying alcohol. Miss Marie, do you take alcohol? Okwemba. Okwemba, do you take alcohol? Any alcoholic person, even if it is small, small, like this, alcohol is alcohol. So if you take alcohol and you are pregnant, you know what can happen. Now we have said, you remember we are preventing to come out with problems of the heart when a baby is in your stomach. We are preventing problems of the heart when your baby is pregnant. So we have talked about avoiding alcohol and chronic management of chronic diseases. Alcohol crosses the placenta. That one I've said. Stop smoking. Stop smoking and drugs, nicotines. Review medication. Review medication like tea is my alcohol. I am Naliaho said tea is my alcohol. Yes, I am Naliaho. Please drink tea. Drink tea or drink music like me. Drink music and smoke music like me. Now, you review your medication, interfere with development of during first trimester. The first trimester is the first 3 months of conception. You get the first 3 months of conception. Genetic counseling, is there a family history? In your family, is there a history of these problems? Are there any other babies that were born with these problems? If they are, you need to Okwemba, that is very nice. A society with young people that are not taking alcohol is a good society. Good morning, Benjamin. You're watching the live on TV, and you can send names on the thumbnail. Please, thanks. Okay, someone has just sent me a message. Okay, now, a society of young men that do not take alcohol is a generation that will be blessed and will develop very well. Now, genetic counseling means, is there a, a history of CHDs in your family? Is there a history of people that are born with these problems? You get it? So you should always look back and go for genetic counseling from the specialists. Now, maintain healthy weight. Don't be diabetic. Don't take a lot of junks and carbs, because obesity is linked to metabolic and hormonal imbalance. If you have a very big body because of eating junk, more carbs, and becoming so big, it is linked to obesity, is linked to what? Metabolic and hormonal imbalance, and you may bring up a baby that is having a defect in the heart. You get? Yes. Congenital abnormalities. Good nutrition. Yes. Iron. You just imagine taking some fruits. You wake up, you take some iodine, some little salt. You check it. Beetroot, some good fruits. You take some parts of the liver as a mother, and then you shine your skin. Some greens, like managu, like sugar. That is in your plate of ugali. Ugali is pap. For those who don't know ugali is cornmeal. You see, just imagine as a mother. And then the vegetables that have complex vitamins, they go to your body, they bind. Vitamins are called cofactors. They bind, your skin looks soft. Your smooth face, glowing, and you are a mother, and you are holding life inside, protected under your amniotic fluid in the uterus. Yes, you see, you feel nice when the baby is kicking and growing after the 3rd trimester. The baby formation becomes so nice. progressively better as a mother. Just imagine. But you are there, you want KFC, you want pizza, you want fried fish, you want, and you remember we talked about some things called free radicals, man. Free radicals everywhere where there is fried food. Mothers, man, mothers. Take that chicken, that fowl, boil it, boil the fowl, drink the soup. Eh, drink the soup. Get some good vitamins, get fibers. Eat beans with maize that is mixed. We call it githeri. Let the fiber do. Broccolis give you more vitamins and some ions. Get it? You get it, man? Yes, fine food. And then you'll be a fine mother with a fine baby, producing fine baby boys and fine girls. Hey, what can I say about that, man? Good nutrition. That one lies under good nutrition. Good nutrition. You feel nice when you're producing good babies, and when you are pregnant, you are glowing like a good mother. Yes. No alcohol, no drugs, good vibes, good food from the shamba, and you feel nice. Now, there is this situation during pregnancy. What can you do during pregnancy so that you can have a baby who does not have those congenital heart defects? What can you do as a mother to avoid those conditions of congenital heart defects? Let's see what you can do as a mother. What can you do as a mother so that you cannot have regular antenatal clinic visits? You should visit antenatal clinics regularly. And why am I saying you should visit antenatal clinics regularly? Because they will check your hemoglobin levels. They will check your, if a Dudes page, big up Dr. Benjamin Dudes from Jamaica. Yeah. Welcome to the platform. We adore your presence, and today we are talking about mothers, avoiding mothers to give birth to children with heart conditions called congenital heart defects. Defects of the heart getting holes and transposition of these big veins and arteries. Yes, welcome. Like the video, Dudes page, and share this, and let's go and let's make the society healthy. Now, we talk about what is called regular antenatal clinic. You should visit the antenatal clinic regularly. Why? Because they will check your HB levels. They will do a full hemogram. If you are sick, if you are on medications that you are not supposed to be on, they will change. And you've seen medications are a big concern when it comes to pregnancy and the baby's formation. You see? Yes. We have seen that it's very important. Take prenatal vitamins like folate, iron, and calcium. Your baby is growing and your body metabolism, it is at a high level. So you need these calciums, you need these folate ions for DNA synthesis for your baby. Don't say they taste bad. No. You are taking care of a life, man. Yes. Now, let's go to avoid infections like rubella. Rubella infection in pregnancy can directly damage your kid's heart. Directly damage, causing things like tetralogy of Fallot. We have said tetralogy of Fallot is what? It has got 4. And that one is where your heart has a problem with oxygen. So let's revisit tetralogy of Fallot. Tetralogy of Fallot is 4. We have ventricular septal. Oh, it is called the blue syndrome. Another name for tetralogy of Fallot is the blue syndrome. So you have a baby is born with a hole between the heart, the septa here of the ventricles, and then blood is more here. The right ventricle becomes bigger, and then we have the other one, which is patent ductus arteriosus. Patent ductus arteriosus. The hole between the outer and the pulmonary vein does not close. Blessings to everyone on the platform and the background listening. Yes, Jamaican Uncle is always here. Thanks a lot, Jamaican Uncle, for pushing and being there always. Thanks. Patent, we have one whole, we are talking about tetralogy of Fall. Thanks a lot, Doctor, for the lessons and enlightenment. Oh, thanks a lot. I am Laliaho. If you have someone who is always in students that are studying medicine, nursing, all send them here. If you are interested with a group, we can do something that is called enlightenment. I'm Laliaho. That is what we do. So I'm saying rubella can cause tetralogy of Fallot, whereby it can cause ventrocentral defect, a hole between the heart, and then blood becomes more in the right ventricle. The right ventricular muscle becomes bigger, the right side of the heart, and then the next thing is patent ductus arteriosus, the hole that is supposed to close when the child is being born, it doesn't close. That is the other one. And then the last one, coarctation of the outer. The outer becomes smaller. Imagine that case. Imagine that case because of rubella. You refuse to be given rubella vaccination. You know, there are some churches or religions that they don't do that. I'll not talk about that here. But please, if you are pregnant, hello, Dr. Ben. Yeah, hi, Christine Long. Welcome to the platform. As you check in, like and subscribe if you've not subscribed. But I know Christine Long from long time. That is my long time friend. And I know she's always here to support and to tell me, go, doctor. It's this that we want. We need information. So, Christine, your like is important, your thumb up is important, and anyone else who is watching, let's give the thumbs up, thumbs up, thumbs up, thumbs up, thumbs up. Good. Now, when you're pregnant, to avoid CHDs are congenital heart defects, and you've seen how they come. They come with holes. Yes, Christine Long is my good friend. Nice. Sometimes I feel these people, we should meet one day, but I know we will. It comes with transposition of pulmonary veins, transposition of constriction of the outer, constriction of pulmonary artery, holes in the heart. Just imagine. So prevent infection during pregnancy. Do what? Get immunized. Women, if you are not immunized on rubella and you know you want to get babies, you want to give us bouncing baby girl, bouncing baby boy, Efasi Lipenga, and everyone watching, we are here, Efasi, thank you. Make sure you are immunized on rubella vaccination. Rubella, it's a virus, a very toxic one, a very bad. As we go on, anyone with a question, here always to receive and share. So if you are here with a question, please let me receive and share. Hello, doctor. Oh, Dorothy K is here. Dorothy K, my good friend. Today we were talking about congenital heart defects. Erika. Hey, Erika. Hi, Erika. Hi again. Yes. I can see you here, Erika. We are here. We talk about medicine, medical problems. Elmarie Smith. Hey, people love me. Yes, Elmarie. How are you doing? I hope you are okay. Because you are here, let me give a recap. Erika, Elmarie, and so we were talking of how we can prevent congenital heart defects. If you have not gone through the video of congenital heart defects that babies are born with, please check the video on congenital heart defects that we have divided into acyanotic and cyanotic. So congenital heart defects are two and categorized into two, acyanotic and cyanotic. So we are preventing our women from giving birth to those children that have this problem. So we have, can I give a recap? I think I can give a recap before I continue. We have said one, Take folic acid. We have talked about folic acid. Control chronic diseases. Avoid alcohol consumption. Stop smoking and drug use. Stop smoking and drug use. Genetic counseling. Maintain a healthy weight, because overweight increases metabolism and it disturbs what? The baby's doctor. I'm fine, thanks. Oh, well, Mary, thanks a lot. Yes, you see that. And then ensure good nutrition. And during pregnancy, we were at during pregnancy, that is preconception. We were talking before pregnancy, what you can do. So now we are talking during pregnancy. During pregnancy. Now, our baby girls, our mothers have conceived and they have started the journey of 9 months. Yes, they have started the journey of 9 months. What do we do now, our mothers, so that they can stop doing what? They can stop getting, let me get a sip of this so that I can continue. My throat is becoming very nice, very nice. Very nice. Now we don't want our mothers to give out children to give birth to children with congenital heart defect during pregnancy. What do our mothers do? Regular antenatal visits. Regular antenatal visits helps monitor mother and fetus. When you go antenatally, antenatal is when you are pregnant. And if you are coming in today, just now, please like the video so that we can get more impressions. Mercy Grace, wow, Mercy, hi, Mercy. I missed you a lot, but I saw you on my live and at night. I'm 44. Can I get my last born too? I'm out of topic. You are not out of topic. You are on topic. If you have not liked, please like. Dorothy, 44 you can get. Who said you cannot get a baby? Or you'll say the Bible is telling us things we can't follow. You can get a baby. How old is your last born by now? How old is your last born by now? Dorothy, tell me, how old is your last born by now? People get pregnant even at 45. What God can do, no man can do. So, Dorothy, you can get your last born at 44. That is possible. Who is not liking? Who has not liked the talk? So the topic is, let me review the topic. Last time, because someone has told me, though he's come late, we talked about congenital heart diseases that babies are born with. Congenital heart diseases are categorized into cyanotic and acyanotic. Acyanotic are those that babies are born and the problem has at little oxygen in the heart. But cyanotic are those that babies are born and they don't have even oxygen that is supplying. So look at this heart. The ones that your babies are born and they have a little oxygen, it's called cyanotic. One, it is called atrioseptal defect, a hole between the right atrium and the left atrium. Here, the foramen ovale did not close. Two, ventricular septal, a hole between the right and the left ventricle. Here, you get it, ventricular septal. And then we have another one called patent ductus arteriosus, a hole that was not closed between pulmonary artery and aorta. Here, when the baby was born, it didn't close. 4, we have coarctation of the aorta. Coarctation means narrowing in medicine. Oh, Barbara is here. Barbara, welcome. I'm giving a recap. My last born is 14 years. Dorothy. Before I finish, I'm going to talk about how you can get a baby at your age. That one I'm going to talk. So, coarctation of the aorta. And then we said we have another one called acyanotic. Acyanotic is those that problems that a baby can be born with even no oxygen that is going through the body. The first one, which is the bigger one, is called tetralogy of Fallot. Has 4. Tetra means 4 problems. 1, it has septum. a hole. This is one heart with a hole at the ventricles. Then the right ventricle becomes bigger. Two, we have what? Tetralogy of Fallot. We have pulmonary stenosis. Pulmonary stenosis is this pulmonary artery is small, and then we have we have overriding aorta. This aorta comes direct up to here. It attaches itself anywhere around here, around the right atrium or down here. Overriding aorta, it's overriding the pulmonary artery. Those are two, and then we have something called TAPAF, total anomalous pulmonary venous return, anomalous. So this pulmonary artery, instead of coming here where it is coming to the right atrium or here, down here, or it can come up to the septum, a hole here. So those are the things. So right now, we are talking about how we can control and how we can avoid our women to give birth to children with such cases. Now, we have talked about several points. One is take folic acid, control chronic diseases, avoid alcohol consumption, stop smoking and drug use. Review medication with your doctor always. Get genetic counseling, check if in your society or in your background there is someone who has this. Maintain a healthy diet and weight, ensure good nutrition. But there is this place that we are in now. Those ones are before pregnancy. Now let's talk during pregnancy. During pregnancy, what can you do so that you don't get children with holes in the heart and transposition of those defects that you have checked? We have said, visit the antenatal clinic regularly to be checked. First, very important, take perinatal vitamins like folic. We have talked about how folic works. Please review the video. Avoid infections like rubella. Women, get vaccinated. People sometimes, I saw people were so worried about the COVID vaccine and how it was rolled out. Now here, we don't avoid. Here you get rubella vaccine. Very important. Control your blood glucose. It is very important. If you are diabetic, poorly controlled can cause diabetes, can cause abnormal heart structure in a baby. And the other thing is, if you are diabetic, you can give birth to a baby and you are not controlling your sugar levels. You can give birth to a baby who is called a macrosomia. A macrosomia is an overweight baby with a big head. So control when you have diabetes, avoid chemicals and radiations. If you are a farmer, those people that are doing big scale and farmers that do flowers, a big scale farming of flowers, they use a lot of chemicals, insecticides, pesticides, and avoid x-rays. So that's why when you are pregnant and you come to a hospital, maybe you want to check something like a fracture, we rarely do. We are taking care of your baby's growth, mostly at the first trimester, the first 3 months. We rarely do those x-rays on the first trimester. Now you know why you went to a hospital and maybe you are suspecting you have a fracture, and the doctor decided, no, you are not getting an x-ray. And you became mad and you went home lamenting. That doctor, no, now you know why. I hope the doctor said, if you have any question, I have one question that have been asked. Can I have a baby at 44 years? Yes, that is one that I'll start with. So let's see about any other question. I'm still continuing. I'm still continuing. I'm still continuing. If you have a question, please roll it out. Let's talk. Let's talk. Let's engage in some discussion. Who has a question? Yes. Avoid unnecessarily medication when you are pregnant. They are harmful. You have seen there are some medications that we have gone through that are teratogenic. They can destroy your baby. Teratogenicity means drugs that can have the potential to destroy your baby. Please avoid drugs over the counter when you are pregnant. I'm still saying avoid drugs over the counter when you are pregnant. Take balanced diet. Vitamins are very important when you are pregnant. And so for my ladies, I usually say when I call them ladies, my ladies, it's a very good name to call you, respectable way of calling a woman. Call that lady, my empress. Yes. Empress number one. Girl, I wanna be with you. A real woman, yes. Queen of the motherland. Hey, Empress number one. Them ladies, you hear me? Hmm? Eat vitamins. Take vegetables. Take things that are nutritious. And I'm not saying delicious things. Nutritious things and delicious things are totally the absent way, but they can go hand in hand again, how you prepare them. You see, the problem comes when the word delicious comes in. The problem comes when the word delicious comes in. You want a nutritious thing, but you don't want something that is not delicious. Hey, take some vegetables and you feel this is not what I should be taking. You swiftly rush to KFC. Hey, give me my good drum. They're called the drumsticks. Tomorrow, you are there. I want some pizza. On top. Christine is saying, especially when you have a sweet tooth like me, of course, you are with a big 2 liters Coca-Cola in your fridge, chilling, waiting to be sipped every time. Man, you're giving yourself high carbs that are not good. And now you're giving your baby no vitamins at all. As you take the folic supplement, give your baby vitamins by getting real vegetables, by getting real food that you should be taking. See that? I even have sung for you. I've given you a song today. I'm calling you them ladies, our good respected women. So define between delicious and Stan's Kitchen. Good evening, doctor. Good evening, my friend. Wherever you are, Stan's Kitchen. What is cooking today? Today for me, I'm cooking how to solve congenital heart diseases. What are you cooking? Yes. Now, Elmarie Smith is bigging up Mercy, Dorothy, Barbara. Greetings, all my sisters. One love. Say that again. One heart. Let's get together and feel all right. Feel the music coming and love. Hear the music. Ooh, ooh, eh. Now, we have not finished our topic. Balanced diet, and then treat infections and fever early. Early. I'm being carried by the music I'm singing. Now, when one love, and Marie Smith. One love, how are you? We just cooked some delicious pasta. One love, doctor. Yes, Stan's Kitchen. Thanks for that. I've taken lunch, beans and chapati. Now, when you go to the clinic as a lady, you are done something called VDRL and taken some blood to something called urine analysis, urine analyzation, to check if the proteins are in urine, to check if you have any infection. By when the leukocytes are in urine are elevated, we know this person has an infection. If you have elevated proteins in your urine, we know there is an infection. That's why we take your urine. VDRL means venereal diseases screening, gonorrhea and syphilis. This can be a fatal thing to your baby. It can give you congenital heart diseases. Infections by E. coli is a bad thing. Infections by those UTIs that you get, trichomonas vaginalis. You go to the loo as a lady, and when you check, when you wiping yourself, you are seeing a yellow discharge. That is called trichomonas vaginalis, or a green discharge. That is an infection. That is what we go and screen. If you are coming in, my ladies, my friends, my family, please subscribe. Don't forget to subscribe to me. Don't forget to like, and we talk. And don't be shy. Just ask. Just ask what if your friend once had a problem with a baby. If your friend once had a problem with how she was carrying herself while pregnant, ask for your baby. Now, you treat the infections. Infections are direct thing when it comes to destruction of our baby and fetus. Infections. Please treat infections. Teach our young women on sanitation and how they can handle themselves. I will not talk about promiscuity. I work in a hospital, but already know what I've talked about. People come to hospital with venereal diseases because of promiscuity. And then the baby is born with complications because the mother could not chill out. Can I stop there? I rest my case there. We continue. You understand. As you listen to this, you understand. So our mothers who are elderly, our fathers who are elderly, talk to our young mothers who are coming to be parents about promiscuity when pregnant. You know what I mean? It is ugly. Ugly. Or I shout uglier. It is ugly. Yourself, you are giving yourself infections, and you are destroying the baby before this baby is born. Yes, I've talked about that. Now, let's move forward to limit caffeine. Before I sleep, I want to take some caffeine and feel good. Caffeine may reduce placental blood flow after fetal growth, indirectly impacting the heart health. So people that love caffeine, those people that love coffee, yes, now you know. People that love caffeine, you are told you limit taking caffeine when pregnant because it is limiting blood flow to the baby's heart. It is limiting blood flow to the baby's heart, and you may get congenital heart defects. You get manage stress and rest well. Yes, just be relaxed. If you are married and you have someone when you is around you, make sure it is good and you are feeling good with this person. Yeah, men, men. Yeah, I'm talking to you. If you are a man and you're here, and you have done mambos, you have done things, and your empress is just about to give us another life. Be closer to your woman. Treat a woman like your empress. This is where your woman is having hormonal storms. Don't react while your woman is reacting. Give your woman attention. Let your woman know you are there for her. Take your woman to clinic. Be there. Well, as she you are there to smile. How many men take their women to clinics? If you are Okwemba, are you married? Oh, Okwemba is not married. Okwemba is not married. If you have never taken your woman to ANC clinic, you're not doing the right thing. Or am I talking to the wrong people? No, I'm not. I'm talking to the right people. If you have never taken your woman to ANC clinic, now look at me now, and say, I will next time. Stress management. That is where it comes in. Stress management. Help your women to monitor stress management. Our elderly parents, please, let's help our young women and men to handle stress at the early ages when they are having babies. Yes, stress. We talked about what hormones are suppressed, and they help in management of our babies. Screening tests, do every 3 months an ultrasound to find out if your baby is okay. Echo, fetal echo, check your baby's heartbeat every time so that we can know how your baby's the heart is beating. Is it in the normal rate? Is it rising? Is it slow? Very important. It is very important. Now, we have talked a lot about management of tomorrow. Tomorrow, this one, what I've talked about, you see, it's a very big topic. This one is prevention. We will talk about now a child who is born with the complications and we want to manage. Yes? We will talk about that. Now, time for questions. You have no other one and no any other. Hey, I have so clever audience. Every time I come, they are clever. They grasp everything. They don't have questions. Please ask me questions because you will go asking yourself, what was Doc telling me? Don't just follow up. The question was, can I have a baby at 44? And if I want a baby at 44, what can I do? Dorothy, what can I do? What changes at age 44? Let's ask ourselves that thing. What changes at age 44? If you are coming in right now, it's time for questions. Questions. Please give me questions. I have 20, 30 minutes. I have 30 minutes. Give me questions now. I answer them. I've started by the question of Dorothy. Can I have a baby at 44? I need a last born. I need someone that will be running around the house when the other older ones are not there. Yes, it is very important to have that. Now, what changes at that age? Reduced fertility, few and low quality eggs, and high risk of miscarriage, chromosomal abnormalities, and pregnancy complications may be there. I've not said they are there. May be there. So, what? Yes, it's very possible. Yes, I'm Naliaho. It is possible, and that's why I'm medically advising our sister now. And someone else should be coming out with a question that of concern so that we discuss. Someone else come out with a question of concern so that we discuss. See a specialist early. Visit a gynecologist or fertility specialist. But if you have tried, because maybe you have not been trying, there is having when you have been trying and not having when you have not been trying. At these ages, some things go down. So you start staying with your husband like a brother. Your dearly brother. At this age, many people stay with their wives and their wife stays with their husbands like the brother. You should know that now you have stayed for long, but you should pimp things out now. Don't try. Don't try to be slow on this. Be that girl that you met some years ago. You see, when you come back and start doing things that you are doing when you are smaller, you start revising the hormones to come out. Eh? You look at him like that young man that you saw some years ago, because they are exciting some happy hormones like serotonin and dopa, pleasure hormone, dopa. Dopa is the one which makes your estrogen to come out so that it makes you feel like a woman. You see that, Efasi, you are smiling. Oh yeah, oh yeah, oh yeah. Sweetness, my friend. Sweet is always in happy hormone in the brain. Sweetness. You imagine that? Hmm? How many times has you ever told your husband at age 40 or 38, you are a hunk, my friend? Eh? See you soon, dear. You are a hunk, my friend. I got gold. Don't just look at your man always and say, yesterday I wanted this, but you did not give. I'm here, guy, but in the background. Thanks a lot. Thanks a lot, dude space. Yeah. You always complain because you are used to your husband and you are used to your wife, and now you are living like siblings because of complaints. Hmm? You see, because children have grown, they are looking at you like parents, and they may ask questions. Now you don't want to do things that you used to do. Eh? Go and listen to Cecile. Eh? Go and listen to Cecile. I wish I could rewind and be your ex-girlfriend. Hey, hey, yeah, you see those things. Hormonal level returning back. They need excitement. Check on the uterine health. Uterine health. Now, these are the things you should go to the doctor. Efasi Lipenga is very excited about this topic. Efasi, how old are you? Oh, sorry. I'm not supposed to ask a lady how old are you. You are young enough. Sorry about that, Efasi. You are very excited about the topic. Start prenatal supplement. Of course, when you need conception, start the supplements. What are the supplements? Folic, iron, calcium, and vitamins are advised. You get it? Are advised. You start the supplements. It's very important. It's very important. Hmm? So when you are at these ages above 38 years, I'm giving you some tips that you can have. Maintain a healthy lifestyle. Maintain a healthy lifestyle. Eat a balanced diet. Maintain a healthy weight. Avoid alcohol and smoking. I'm still I'm sorry about that. You are old enough. Yes, you are old enough. Very old enough. Beautiful lady here. Efasi Lipenga from Zambia. Zimbabwe, yes, Zimbabwe. Exercise moderately. Exercise moderately. Always exercise moderately. Do you know why? The more you exercise, the more estrogen is produced and follicle stimulating hormone is suppressed in your brain. You get this? Try natural supplements. Morning, everyone in you. I have not asked one question to the person who brought this topic up. Are you trying or are you just there? You know, there is trying and not getting, and there is I'm not trying but I want. So please, if you are okay by us answering me that question, please answer, because it is two-way. You may be trying and maybe there is a primary and secondary infertility. Primary and secondary infertility. So because you have another child about 14 years old, are you trying or Malawi? Yes, from Malawi. Our lady from Malawi. Thanks a lot. Are you trying or you're just there? Please, if you are okay, answer me that question. Try natural if possible. If you still ovulate naturally, natural conception is possible. if you are feeling the signs of ovulation. Some ladies don't feel signs of ovulation. Hey, my friends, it is question time. So if you have any question, this is the question that I was asked, that can I have a baby over 40? Over 40, can I have a baby? If you have a question, please ask. If you still ovulate naturally, high possible, you can get. Track ovulation to improve timing. Timing. So this one here is where we talk about safe days and unsafe days. Safe days. Now this one, we will not say it's unsafe days because we want a baby there. So it's not unsafe. It is the dates that we want. After the 5, a normal cycle of a woman can go to 5 days. That one we say it is safe. So menstruation 5 days, and then you add 3 days or 5. 3. Let's add 3. So from 3 days before menstruation, that is 8. 3 days before menstruation, if you make love, you'll not get pregnant. And then 3 days after menstruation, let's take 5 menstruating days. So that is 5 plus 1, 2, 3. Sorry, Doc, I was late, but today, greetings, everyone. Thanks, welcome. If you are coming in right now, please don't forget to hit the like button. I can see Ridley in the house. I can see Smile in the city. So 5 plus 6, that was 11 days. So after the 5th day, after menstruation, the 5th day, we call it safe day. But now it's not safe. We want the baby. We want to have a baby. Now from that time is where you have your man around. You do when you are alone in the bedroom, you do your makeup, you dance, you jump in bed, you dance, you get it. You put on a romantic song. You put up a romantic song after 5 plus 3. 5 plus 3. Now we want the baby. Yeah? Your boys are big, your girls are big, they are not in the bedroom. Or you sing for yourself to your man, like, look like we made it. Look how far we've come, my baby. I might have said, hey, you get it. Now that we are holding on, say you're still the one I ran to, and then you jump in bed, you say, the only one I deserve. Now we are making it happen. You get it? You're making it happen. Hey, my sister. Hey, you're here. Margaret in Norway is here, my sister. Hey, my sister has found me singing. Now, that is the time. You get it. You sing for him. You make him know you are around and you're still lively and you're still that girl that you met. Natural way. You're talking of natural way. Yeah. Who asked this question? You have asked a question. The person who asked this question have asked a question. Are you trying or you are not trying? And you have not get any response. If you are trying, you tell me. Consider, Doc, you are a great DJ. That's my brother Ridley from another mother in the US. Come on, Ridley. I miss the days that you stepped in Kenya. The first time you stepped under the motherland. It was fun. Ridley, it was fun. You had fun in Mombasa, in Nairobi. We need to meet again, my bro. We need to meet again. Yes. Thanks a lot for that. Thanks a lot for that compliment. Now, there is other ways that you can do by considering fertility. Dorothy, are you around? Is Dorothy still around, please? Hi, Christine. Hi, Kingre. Hi, Emphasis. There are other ways, but because 14 years is, let's see about secondary infertility. Yeah? Let's see about secondary infertility. Because you see, sure, we'll meet again. Haiti finest. Hey, Haiti finest. Long time no see, sis, man. Long time no see. Easter's been good for you, yes? Miss you, sis. Miss you so much. Where has my sister gone? Hey, sis, where are you? Meg, where are you? Are you hiding somewhere? Somewhere. My sister Margaret in Norway. Meg, where are you? Please come out. I'm here now. I'm here now, Haiti Finance. I love seeing you on my channel, man. If you have not liked, hit the like button. Let's fly high. Let's get many impressions. Now, I'm here. Oh, sis, when you run away, I feel like crying. You want me to sing that song of I saw you yesterday. I don't want. It's a big tune with a sad message. Hmm? I don't want. So the question today was, can I get a kid? Or if you are coming in late, we have talked about how you can manage yourself when you are pregnant, not to get congenital heart defects for your baby. And then tomorrow we will talk about if your baby is born with congenital heart defects, how can you manage them? How can you manage them? And then there was a question that came in, which I'm managing right now. Can I get a baby 40? Can I get a baby after 40? So people that are coming in, I know you will rewatch, and we have come to a place whereby we need to know primary and secondary infertility. This is a question that of interest and many people are struggling with them. So primary infertility, never conceived before. This is a person that has never had any baby, but you are trying to search. Secondary infertility, conceived before, but now you are trying, but you cannot. Now, causes of infertility. Causes of infertility. Let's get to see. Let me rewind and come again, selector from the key differences. Listen, I'm talking like a DJ. Ridley, you have made me to start talking like a DJ. Let me come again and rewind selector from the key differences. Aye. Now, listen to this. Primary infertility, never conceived before. Secondary infertility, conceived before but now is unable. And the person is trying. Now, causes of secondary infertility, There are some causes. We are still coming on. Please like and share the topic. Like and share the topic to your friends. It may be helpful. Female causes, ovulation disorder. You have regular circles, irregular circles. Today they have come after 1 week, tomorrow they'll come after 3 weeks. You understand, irregular circles. Common in conditions like polycystic ovarian syndromes. Polycystic on the ovarian syndromes. Hormonal imbalance like thyroid and prolactin. Hormonal imbalance, because your thyroid controls several hormones in your body. So if you have hormonal imbalance, you may not. That's good to be your secondary job, DJ. Nice guy. Yeah, nice. Really, that sounds nice. Hey, the love of music, man. The love of music. Now, there is tubal damage, blocked or scarred fallopian tubes, often due to pelvic inflammatory diseases, previous ectopic pregnancies, post-surgical adhesions, when you have done surgery and the tubes have got scars and they have adhesions. And uterine problems, of course, fibroids can make you not to conceive. Uterine adhesions, there is a condition called Ashman syndrome. Endometrial damage after producing like curettage. You see, when you get a miscarriage, what we do is we do something called curettage. The POCs that are left, we scrap them from the uterus so that you cannot continue bleeding because they are still attached. It can damage your uterus. Endometriosis. That one is a topic of concern, and it will come specifically as its topic. Endometriosis causes inflammation and scarring and pain in your womb. And then, not women alone can have this problem. Even men can be part of the problem. 40, you may start struggling to get kids. Reduced sperm count and motility, erectile dysfunction, infection affecting the testes, and lifestyle factors like alcohol, smoking, and taking a lot of drugs, because now you are above 40 and you are seeing your things are not going as per what you want. You start giving yourself up so that you can forget what your plans were before 40. Men, please reduce alcohol intake. Our women need us. Our women need us to give them the sweetness of marriage. Yes, the sweetness of marriage is holding her tight and telling her, you are the queen of motherland. Empress number one. Yes. Empress number one. Girl, I wanna be with you. A real woman, yes. Queen of the motherland. Don't let down your wife, man. Don't let down your wife, Bana. Make your wife know that she's everything. She's what you have plus this. But sometimes men let down their women. Yes, because today you have been given a good meal. You have served with a good meal. Delicious. The woman has waited you from 4 in the evening, making herself ready, good makeup, feeling nice. Today, my husband should know even me, I'm still that young lady. And then you come home very tired, thinking about work, thinking about, you don't see even your woman as that woman you saw some times ago. You see, these are the effects, things that make you not to get children. And then your wife sleeps beside you, crying inside after all the makeup she has done, and you cannot even erect. Oh my goodness, oh my God, things that make male gender not to get children after 40. Yes, wasting your sperm on some women outside there, wasting your sperm on women, side chicks. When you are there, you want to show them you can perform better than their young boyfriends. And then you come home, you cannot perform, my friend. What do I say? What do I say? Multiple partners and you want to get children. Now, I'm talking as a medic, Please don't misquote me. I'm talking with experience, with what I see happening. So don't misquote me. I'm not talking about anyone. Yes? Outside there, you use condoms. At home, you don't. So you waste your sperm. You will not get kids. Your sperm count will go down and you will not perform. God created a man for the woman, a man for the woman. Even Adam had Eve. I didn't see Adam with Eve plus another one called Redemptor. No. Hey, today I'm talking so much. I think that question was important. That question was very important. And even Jesus said, if you can stay without one, stay without. If you can. Greetings, doctor, and everyone. That is my beautiful friend from South Africa, who is called Beauty. I told you to start a YouTube channel. People want to see you. You are always supporting us all, big YouTubers and small YouTubers, but you don't have a YouTube channel. We need to support you again, Beauty. So, process. I'm on male because we usually say it's female alone. Females who have problems when it comes to conception. Even men, the doctor, DJ, and the comedian. Hey, Eversy, I've turned to a comedian now. But you see, Eversy, these things I'm talking are making sense. These things I'm talking are making sense. Sha travel in the house. Sha, we love you. How are you? Sha travel. When you come in, we feel the channel just doesn't post. Oh, okay. Beauty, you have a channel. Start posting now. So if you are coming in right now, don't hesitate to give me that like. Give me a like, please. Give me a like. Let's share. The question of the day was: I'm above 40. I am above 40, but I can't get kids. I want a kid. And then my question was, are you trying? I love you all too, Dr. Benjamin. We love Sha Travels. We love Sha. Every time I'm clicking in Sha Travels channel, she's always driving. Sha Travels, I love music, but you love cars. May God bless you with that car that you usually see and say, I wanna own this one day. Sha Travels, may God bless you with that car. Which car do you really wanna own one day, Sha Travels? Tell me that car. Tell me, please. Gabriel, my friend, my Kenyan brother, my Kenyan brothers. I heard you. You know, there is a lady who greeted you in Kamba language, and you replied in Kambala, oh, Mercedes Benz, Benz. Gabriel, that was my Empress number one. She comes from your region. The one who greeted you, Gabriel, in Kamba, and then you replied in Kamba, that is my Empress number one. Yes, Empress is a lady who is respected in the society and makes people feel that the mother of the home is here. Benjamin, big up, and everyone in the house. Thanks a lot. Sha Travels, Mercedes Benz is the type of car that I want to see you drive one day. AMG. Do you like whoa, I didn't know. She always comes here and people never know that she's here. And she laughs at me at times when I'm home, telling me how I was funny. Like today, I know I will not sleep. They will be laughing at me, all of them. Now, uh, I was saying what? Oh, I was anointing Sha Travels to own an SUV of Mercedes Benz and as a AMG 8 AMG Mercedes Benz in the name of Jesus. Now, we have talked about and weighed. You know, this is what I'm talking about is not the topic of the day. The topic of the day was this: how women can avoid. Yes, doctor is my favorite doctor. Kenya. Thanks, Sha Travels. Thanks a lot, Sha Travels. Yes, doctor is my favorite. You see, the topic of the day was how we can help our women not to give birth to babies that have congenital heart problems. I'm very sure you will rewatch and advise other people. But there is this question that came in. I am over 40 and I can't get kids. I want a last born because I have others and I'm afraid that if they go, I'll be lonely in the house. I need someone to be running around and making noise and feeling that someone. You see? So that is them. I've talked about the secondary infertility, about men, and I was now on men. Men, you the first thing was reduced sperm count and motility. We've said erectile dysfunction and infections affecting the testes. And now we come and talk about lifestyle factors. Lifestyle factors like smoking, drugs, and taking alcohol. After job, instead of going home, the first place you go is visiting your friends. Alcohol. You take alcohol because your car knows at home, but doctor, I'm trying to have one more. I don't think it will work. I am 61. Hey, Sha Travel. Now you have the same questions like one of us that asked. 61 now. After I finish about our men, I'm going to that now. The ages like 61, because the ages that we are dealing with is 40, 44, 45. Now our men, because they are 40 and they are used to our women, they after work they go to meet as brothers, where they like meeting, taking alcohol. They come home, they are unable to perform. The alcohol has hit their testes bad, and the nerves that are dropping there, the pudendal nerve cannot work. So because your woman is used to it and is not feeling the vibe anymore, the emotion starts to fly low. Oh, let me get the drink again. Hi, Benjamin, late, but I'm here. Yes, let's finish and then you will be watched. And don't forget Rich Soup to give me that lighter. Very nice, very nice. Oh yeah, oh yeah. Today's topic has been so nice. Now, the woman, the follicles starts to die off. Follicles, when the happy hormone is released, they smile. The happy hormones. Do I have a picture of a uterus? When the happy, if you are coming right now, please don't fail to like. The topic today is lit. When the dopamine is released in your brain, the follicles smile. They smile. They smile and they release oxytocin. But now, you as a man, yes, thanks, Rich. You as a man, you always come home drunk. There is no happy hormone in this woman, always sleeping. So, what happens to the follicles that smiles? They start withering. And you remember when we were talking about menopause, it starts from the withering of the follicular trees, follicles. You remember? That was what we talked about. So if you are a couple and you are a man in a relationship, a marriage relationship, or a good relationship that you love each other, stop doing those things. Stop coming home when you are drunk. Stop making your woman in the evening always mad. You are always telling the smiling follicles to stop working. Men, and then I've talked about promiscuity. This one, I will talk about it seriously. You have a side chick, you are using condoms with a side chick, proving yourself that you can do it better than the boyfriend's side, the side chick's boyfriend, so that she can love you more. You can do it better. You waste your sperms there, then you come home. You cannot even try as a Now men are silent. These are natural, they are medical, natural things that happen. And you want to perform, you will not perform. Even your sperm count will have gone down. So you will make this woman not release the happy hormones to optimum, the dopamine, the serotonin, because the woman is not right. Let me use a simple language. You are just touching. You are just touching, and then you are sleeping like a cow because you went to a very heavy gym outside, and now you are coming home. You want to do the same. You cannot. This woman of yours that you are not using condoms will not get kids. Beauty, I see you. Greetings. Wow, dog. What a cool topic. You see, this woman of yours that you're trying to get kids with will not get kids. See your woman as the the young lady, the empress lady that you met the first day, and she was glittering, and you looked at the curvaceous, shiny eyes. Oh, shiny eyes. I remember that song of Judy Butcher. Whoever knows Judy Butcher, please raise. I know some people know. I sang that one day for someone. Yeah, and she had to fall down on the knees. Yeah, you got my eyes when I walk towards my pathways. I could turn away. My eyes won't let me. I thought I was dreaming, but you stood right there in my way. And all my eyes see, it's you. If it is love, my dear, welcome to my world. Please sing for your women that song, even if they are 50 years. It is healthy. It is healthy. Now, let's turn around now. We have talked about so many things, and now we want to go to another. Before I finish, we go to another segment now. What is this? We go to another segment, Dr. Ben. You have me dancing. Doctor, really? I can sing. Sue, I can try and sing, right? And if you know Judy Butcher, please raise your hand. Yeah, life is a train. It's always over 60. Now, today I'm finding if you ask me questions. Yeah? Please, if you have any question, bring it down. Guys, you see what Dr. Ben laugh when I'm in. Maje, hi Maje, how is you, bro? Huh? You're cool, you are cool, eh? You are good, you're feeling fine. Yeah. Yeah, you're good. Today the topic has been so nice and people are feeling cool. We are learning as much as we are helping each other, even socially. Preach to them, doctor. Yeah. Beauty. Men are running away. Where are these men? No, our men are good. Yeah, no. If you are getting in right now, please like the topic and let's go. Now, this is a person who has reached menopause and they have stayed with for some time. The follicles have withered, and the estrogen that is coming out of the follicles is so minimal, and the ovulation has changed. The ovulation has changed. So what can we do for these people? If now this is like a person now that has primary infertility. You see, eggs are taken from a younger woman, they are fertilized with the sperm in the lab, and then you are given in your womb. The embryo is placed into the uterus of the older woman. And you know this process is called IVF, in vitro fertilization. So the fusing is laboratory and the implantation is in the womb of the older woman. Yeah. So this one is very important. You can decide I will rewatch and advert tonight. Such a deep topic you tackled today. Judy Potter was chilling and then Judy Potter was chilling and then he saw Dr. Ben singing her song. Yeah, I have a cousin that's going through IVF, having having the roughest time with it. Don't worry, I'm still here, Doc. Ridley is still in the house listening to our topic. Good, Ridley. Nice. You're a gentleman. You have not run away. Yes. Short travels. What I'll say is, you see, when you are older, some hormones have gone down, and carrying it for some time, it will be hard because you are feeling like you're feeling like this. The years that you could carry are not what you are currently, but after 9 months you are okay. So it's better to do what, to just even the hormones themselves, huh? Even the hormones themselves, you get it, even the hormones, you are 60 plus, you are 58 plus, you are 50 plus, the hormones have changed, and you are having a baby that is growing. This means you should be in more supplements, more drugs, more folic acid, because your body cannot provide as it was providing earlier at your 30s. You get it? So you will have the stress of everything. But we thank God, if you undergo that, you are a strong lady, and you are giving us life after, you are giving us life after all those struggles, and we celebrate you, and we will come at your home with flowers and sing and tell you we thank you for giving us life. It's harder to get pregnant at those ages. Yes, I get it, dog. It is hard. But when you decide this is the what I want, I want to hold my baby, you can do an IVF if you want. But there is another thing that is called IVF plus gestational surrogacy. If you are coming it right now, please, the likes are still popping. Please like Benjamin the wise guy, and tell your cousin, you tell your sister, you tell your brother that there is, FSC has called me a comedian. There is this comedian doctor that give us points, and we laugh and we learn. Yes, FSC. Uh, oh, Gabriel has not run away. Our man is still here. All the men are heroes. Now, IVF plus surrogacy, gestational surrogacy, means a donor egg is fertilized. A donor egg is fertilized, and the embryo is placed in another woman who carries the pregnancy. Now, you want a baby. A donor egg is fertilized. You are the one who is financing this process, and you have signed contract with the woman plus the other person that gave you the egg. You see that? And then you are not the one who will carry. No. You get? You are not the one who will carry. Betty's World is here. Welcome, Betty's World, as the topic rolls around. You will give it to another person. You will give it to another person who will carry for you. Used when the pregnancy is too risky for an old woman. So if you want a baby and you see carrying the pregnancy can be a risk, can be risky, this is the way that you can do IVF plus gestational surrogacy. You sign a contract, you finance the in vitro, and then that egg will be taken to another woman's womb. The only thing that this woman does is to carry your baby. Please, if you are coming in right now, please don't fail to hit the like button. Hit the like button. We get the likes, more likes, more impressions. You get it? So when our other woman is feeling, and you have gone through the test, we have done all the tests as doctors, we have taken, we have seen that by the time you are you're giving birth to this baby, you may have a problem. You cannot carry this baby. We do IVF plus surrogacy. We give another baby to do it. So you check that. Use of previous frozen eggs and embryos. If the woman frozen eggs of embryos early in life, there are some people at years like 30s, 35 to 40s, or 28 there, they get their eggs, the eggs are frozen. The eggs are frozen. Maybe this person was thinking of, unfortunately, IVF costs an arm and her legs, still at the classic song of Judy Butcher and serenading. Come on, Rich Sue. Now we are talking about, please bring some water, Dr. Ben. I have my drink here. Shah Travels, let me take it again. Thank you for reminding me about that. Thank you for reminding me about that. Now, there are some women, when the eggs are taken at the ages of 25 to 28, 30 to 35, maybe this woman was thinking about selling them, but they were still there. So when it comes at a later age with no kids, this woman says, now I need my eggs. They will be fertilized and then they will be implanted in your womb, because at that age of 60s and 58 and 70s, you can't produce the eggs, but they were frozen. So they are implanted in your womb and you carry them. And then we have hormonal therapy and IVF. Estrogen and progesterone are given to prepare your uterus. So if you are that lady at those ages, who is that has not liked the video, please? Who is that? Who is that who has not liked the video? Like one. Please like. So we give you there are some things called menotropy. There are hormones of progesterone and estrogen. We inject you so that it starts. You see, when you give you progesterone, the womb starts to form. Your uterus starts to form. Your uterus starts to form. And when it starts to form, what happens? It is ready for implanting. So after we've given you for like 6 months the menotropin, the estrogen and progesterones, then we implant. Then your womb holds the baby. Yes? Hi. Now, you don't want those. Now, you say that above that, I have done everything, I just need a kit. You adopt through the legal process and foster care. You see? But at those ages, if you want to go through the normal, the ones that we have said, yes, people that have high blood pressure at those ages, diabetes mellitus, heart conditions, miscarriages, preterm deliveries. Very careful when we are handling them. We are always careful when handling them. So please, I think when Dorothy, she's gone out a bit, when Dorothy will be reviewing, she will come back and she will know what we have done. Don't forget the topic of the day was, you have even forgotten the topic of the day, preventing congenital heart diseases. Please start the video from, or is there any other question? Anyone with any other question that we can handle? But please rewatch this. It's very educative and important to our mothers and couples that are having children, mostly when it comes to congenital heart diseases. When it comes to congenital heart diseases. Anyone with a question? I give like 5 minutes. Oh, it is 6:30. Wow. Hey, no wonder today I've really sung a lot. Now, anyone with any medical question, my friends, I can see everyone has been here. Beauty, Jamaican uncle, my big brother, my father there, Jamaican uncle, Rich Sue, my sister, Meg from Norway. Meg from Norway is my sister. I love my sister. She's always smiling. Please visit her channel. You will see her smiling every time. And I've seen Gabriel Wow Ridley today has tuned in. All these people, I adore you as we continue. You remember, I'm waiting for anyone who has a question. I'm waiting for anyone who has a question. So, my time, weekdays, My time weekdays is 4:30. 4:30 in US is 4:30 in US is around, that is chemical operation. What about chemical operation, Ridley? What about chemical operation? Okay, okay. All that is my time. My time always is 16:30 Kenyan time at East African time. So you try and find out what will be time where you are, because we are worldwide. We come from Australia, the US, everywhere. Everyone supports me. So, and when there is a topic of importance, we come at 10 Kenyan time, 16:30 or 10 Kenyan time, because at 16:30, look at every patient and they are relaxing the drugs. And at 10:30, I've always the ones that have come with the emergency. So I've got some time to chill down and talk to my people. Yes, imagine we have talked for 2 hours and really chemical operation. So we'll have to look at replay. I be at work when you come on. It's okay, Sha Travels, it's okay. I thank everyone who has been here. Oh, 11 a.m. Okay, at US it will be 11 a.m. Yes. So we thank everyone that is supporting Benjamin the Wise Guy. I'm just a medical practitioner trying to help people to know what they can do when there is an emergency, or talk to students even, so that they can pass their exams and know what to do when they are disposed to the public. That is my verge, you see. And everyone is appreciating and coming through to my channel and saying, let's continue to do this. I thank you a lot. So, ladies and gentlemen, one last question. There is someone who has a question but is not saying it. One last question. Who has that question, please? Who has that question? Who has that? There is a question I saw somewhere, but it has gone somewhere. It has gone. So, we have dealt with, we always got you, Dr. Ben. We need you to save lives. Thank you so much, especially in Africa. Medical field, sometimes when you talk about medical field, you feel, as a medical practitioner, you feel, let me just not talk. Let me say that we have dealt with prevention, and then tomorrow we will deal with management. Now the baby has been born, and this baby needs now to be managed with this condition. And we have said how many conditions classified under 2 conditions. It gives me great honor to come to Kenya and spend some time with you at your facility. Very nice. I'll feel so good. I'll come live with you, and we will know how to help people. You will meet orthopedics. I can organize for one orthopedic so that you can meet, and your line is orthopedic line, so that you can meet Kenyan orthopedic and we see the difference. I can organize one orthopedic, we see. Yes, good. Now, over 2 hours talking. Tomorrow we will manage we will manage children that are born with congenital heart defects. I thank you all that has come to this platform today, and the question that has been brought by our fellow Dorothy, thank you for that question. You see, even Share Travel had the same question. So let's meet tomorrow at the same time, unless I receive calls about any other thing. I'll come at 10. Bye. See you. And don't forget to sing for your partners tonight. Please sing for your partners. Bye. 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 See you tomorrow or see you tonight.